Hello, welcome back. So this is a series of doing pathology for our board exams or medical schools. It's gonna help you both ways. And before we begin this video, I would like to mention that please like and subscribe to the video and stay tuned for the daily videos that I'm gonna post about the pathology that's gonna cover all the major specialties. Let's begin. So, central nervous system pathology, right? We have developmental anomalies and there's neural tube defects. Now, you guys know what neural tube defect is, right? It arises from incomplete closure of the neural tube. Neural plate invaginates early in gestation to form the neural tube, which runs along the cranial caudal axis of the embryo. Now, the wall of the neural tube forms central nervous system tissue. The hollow lumen forms the ventricles and spinal cord canal. And the neural crest forms the peripheral nervous system. So, associated with low folate levels prior to conception, detected during prenatal care by elevated alpha fetoprotein, which is known as AFP levels, in the amniotic fluid and maternal blood. So, Anencephaly is absence of the skull and brain. So in here there's a disruption of the cranial end of neural tube, which leads to a frog-like appearance of the fetus. You can see over here. Where is the diagram? Here. This is encephaly. So, results in maternal polyhydramnios since fetal swallowing of amniotic fluid is impaired. Spina bifida is failure of the posterior vertebral arch to close, resulting in a vertebral defect, disruption of the caudal end of the neural tube, and spina bifida occulta presents as a dimple or patch of hair overlying the vertebral defect. So, spina bifida presents with cystic protrusion of the underlying tissue through the vertebral defect. And here you would see a meningocele, which is a protrusion of meninges, but the other one is a meningomyelocele, which means that it's a protrusion of meninges and spinal cords. And cerebral aqueduct stenosis. Here you would see congenital stenosis of the channel that drains cerebrospinal fluid from the third ventricle into the fourth ventricle. So this is something you need to remember. And it's very high yield. Leads to accumulation of CSF in the ventricular space, most common cause of hydrocephalus in newborns. CSF is produced by choroid plexus lining the ventricles. It flows from the lateral ventricles into the third ventricle via the interventricular foramen of Monro. Now, on learning this, you would like to review some of the anatomy of the brain, which is the neuroanatomy. Because here it's just mapping out that it flows from the third ventricle into the fourth ventricle via the cerebral aqueduct, flows from the fourth ventricle into the subarachnoid space via the foramina of Mengele and Luschka. Presence with enlarging head circumference due to dilations of ventricles, cranial suture lines are not fused. And in Dandy-Walker Malformation, here you would know congenital failure of the cerebellar vermis to develop, and it presents as a massively dilated fourth ventricle, posterior fossa with an absent cerebellum, so often accompanied by hydrocephalus again. Now here in Arnold-Chiari malformation, which is type 2, there would be a congenital downward displacement of cerebellar vermis and tonsils through the foramen magnum. Obstruction of CSF flow commonly results in hydrocephalus, often associated with Myelomeningocele, which is meninges, and that's a pop-up quiz that I'm going to ask you at the end. Spinal cord lesions. Here we are. Syringomyelia. Here you would learn about cystic degeneration of the spinal cord, arises with trauma or in association with type 1 Arnold-Chiari malformation, usually occurs at CAT1, and it presents as sensory of pain and temperature with sparing of fine touch and associated position sense in the upper extremities, cape-like distribution due to involvement of anterior white commissure of the spinothalamic tract, where it's basically with the sparring of the dorsal column, and syrinx expansion results in involvement of our spinal tract, leading to muscle atrophy, weakness, decreased muscle tone, impaired reflexes due to damage to your lower motor neurons of the anterior horn. Now, Horner syndrome happens and it comes with ptosis, droopy eyelid, meiosis, which is constricted pupil, and anhidrosis, which means decreased sweating. Due to disruption of lateral horn of the hypothalamospinal tract, and this is all about the spinal cord lesion. The next one is poliomyelitis. It's damage to the anterior motor horn due to poliovirus infection, as given the name poliomyelitis. It presents with lower motor neuron signs, flaccid paralysis with muscle atrophy, fasciculations, weakness with decreased muscle tone, impaired reflexes, and negative Babinski downgoing toes. So, next one would be Wernicke-Hoffmann disease, inherited degeneration of the anterior motor horn, autosomal recessive. So, presents as floppy baby that occurs within a few years after birth. Next up is amyotrophic lateral sclerosis, ALS. It's very common to be discussed among the neurologists. Degenerative disorder of upper and lower motor neurons of the corticospinal tract. Anterior motor horn degeneration leads to lower motor neuron signs, flaccid paralysis with muscle atrophy, fasciculations, weakness with decreased muscle tone, impaired reflexes, and negative Babinski sign. So here you could see the things we discussed. First picture is Anencephaly, where there's no brain and no skull, and you could see that the fetus might appear as a frog. Next one, the figure 17.2 is Dandy-Walker malformation. And the third one is bacterial meningitis, and this is the gross appearance. Now, lateral corticospinal tract degeneration leads to upper motor neuron signs, spastic paralysis with hypoplasia, increased muscle tone, and positive Babinski sign. Atrophy and weakness of hands is an early sign. Lack of sensory impairment distinguishes ALS from syringomyelia. Most cases are sporadic but arising in middle-aged adults. And zinc copper superoxide dismutase mutation, which is SOD1, is present in some familial cases but leads to free radical injury in neurons. So that's all for today. The rest of the spinal lesions will be discussed in the next video, so stay tuned and don't forget to subscribe. Thank you very much and have a great day. Bye bye.